Today's video is in response to many videos out there promoting cognitive behavioral therapy and psychological treatment for Tourette syndrome's tics. First of all, if we started using a different terminology, such as tics are symptoms, not behaviors, and they are motor driven, not psychological, would it change our approach if we started calling it cognitive symptomatic therapy or motor treatment for Tourette syndrome's tics? Would it change our approach? Would it change our attitude towards it? Because out there, there's a number of medical professionals out there promoting results and cures, which is basically what parents want, and early on start indoctrinating into their child, which is basically telling your kid right off the bat, your brain is wrong. So all we become aware as kids is that tics are bad. So in my case, I grew up hearing, stop it, it's ugly, you're ugly, you're ugly. You know what? I'm 45. I know I'm not ugly, but I still feel ugly. So basically what you're starting are decades of damage to your kid's psyche by wanting them to behave in a way that they are not wired to do. And that puts horrendous pressure on anyone. And kids should be busy being kids. They should not be busy worrying about, whether or not their brains are wrong. Anyone out there who is suggesting that tics can be controlled clearly has not experienced the pressure, clearly has not experienced how demanding and exhausting and painful at times it can be, and also soul-crushing it can be to spend an entire day either suppressing or redirecting tics. Because guess what? A Tourette syndrome body needs to tic. That's what we're wired to do. Just like we all need to breathe, blink, sneeze. This is something we need to do. That's our normal. The only time you should ever ask someone with Tourette syndrome to redirect a tic is if they are causing themselves harm or about to cause somebody else harm. Let me repeat. The only time you should ask someone to redirect a tic is if they're going to cause themselves harm or cause harm to somebody else. The only time ever. Any other time, basically, it's not to prevent embarrassment. It's not to make it easier on you, because basically, cognitive behavioral therapy is asking the Touretter to accommodate the world around us. And it should be the other way around. It should be the other way around. Asking a Touretter to accommodate the world around us is basically buying into the toxic social construct that tics are bad, and it promotes a stigma. So speaking up right here, I'm trying to take steps to end it. What medical professional need to understand is what you're presenting there is not treatment. Because Tourette syndrome tics cannot be treated and they cannot be controlled. But what you should be promoting is that Tourette syndrome tics can be managed. Not controlled, managed. So what you're selling to parents and the public at large is an unrealistic expectation for their kids that they're going to learn to control it and stop the urge, which technically, sets them up for failure. Sets them up for failure. Hello, Maddie. And it's a pretty terrible thing to embed into a child's psyche right off the bat. Anyway, what can we do to help counter that? Well, I think the medical profession needs to start including adult Touretters in the conversation, because technically adult Touretters outnumber medical professionals, Tourette Tourette kids and their parents. Like, think about it. The vast majority of the Tourette population is adults. So if we start having better conversations between the medical profession and adult with Tourette syndrome, I think we're probably going to have healthier kids, healthier attitudes, and we're going to slowly start to dismantle the stigma. At least that's one place that we can start.